Hello, this is Dr. Prajnanika, focused on your fertility health. And today we will be talking about fertility preservation. Fertility preservation is any procedure we do to save or protect your eggs, sperms or embryos so that you are able to have a biological child in future. There are many procedures involved and freezing of eggs, sperms and embryos is one of these procedures. So one of the most common procedures of fertility preservation is cryopreservation. So cryopreservation is a freezing technique by which the sperm or the egg is frozen, or embryos if it is in case embryos are formed, so that they can be used in future when they want to conceive a child. And that's why this is known as fertility preservation. It is literally we are preserving your fertility despite all the odds or the conditions which you might be facing, so that you have a chance of conceiving a child later on. For the person undergoing the procedure, for males if you say, sperm cryopreservation does not entail any risk to the patient. Now for the egg cryopreservation or the embryo cryopreservation, the woman usually has to undergo the IVF procedure and she will be facing the similar risks which is involved in an IVF procedure, that is involved in the surgical retrieval of the eggs. Now coming on to the risk to the future children. So usually these cryopreservation techniques are very safe. We use some cryoprotectants or the chemicals which try to protect these embryos during this process of cryopreservation. And with all the data we are having, we have not found any increased abnormalities in the children born after this technique. Fertility preservation is for two broad categories of patient. First is cancer patients. Once a patient hears about a cancer diagnosis, there is a huge emotional turmoil. Now, who will think about future fertility then? They have to think about their life. But we have to understand that with the recent advances in the treatment, the survival rates with cancer treatment is quite high. And these patients, once they recover from their cancer, will want a chance at their, you could say, producing another life, because they have already faced a situation in which was life-threatening. But the cancer drugs such as the chemotherapy, the radiation, all these might affect their fertility. Again, cancer is also affecting the younger people, and once cured, they have their whole life in front. So, fertility preservation came up for these patients initially. The next category of patient is elective fertility preservation. So, who are those who will go for the elective fertility preservation? First, if you are in a job in which you are exposed to toxic chemicals or military duty, these patients can preserve their fertility by freezing their sperms or eggs. Second is if you are having any disease which may decrease your ovarian reserve, such as endometriosis or any autoimmune or genetic disease which might affect your fertility. And the last category is all women can go for elective fertility preservation if they want to delay their childbearing. Usually it has been seen that women, when they are at the peak fertility, they have to build up their career, they have to reach a financial stability, and they cannot do them both. It is a common saying that a woman can't have it all. So once they reach a financial stability, they have built up their career, the biological clock has advanced and they might have difficulty or may not be able to conceive. So how do you overcome it? At the time of your peak fertility, that is your mid-20s or early 30s, you can freeze your eggs so that they can be put to a future use when you are ready to have a child. So then you do not have to sacrifice you can say your career or your dreams and aspirations just to build up a family. So the sperms which are frozen or the eggs which are frozen for 10 years, they are good as the sperms which have been frozen for 1 month or the eggs which have been frozen for a month or so. So you can say that you can store them as long as you want to without any bad effect or harmful effect upon the eggs or the sperms or the embryos. So whenever we are counseling a patient for fertility preservation, for a male, okay, yes, you are just freezing your sperm and it can be used anytime you want. For a woman, it is a bit different. Once we are freezing the eggs, we have to, even though some say it is like a future insurance, it is very important. You have to understand that fertility preservation is not equal to insurance for your fertility. Your end point is you want to have a child. When we are freezing your eggs, when we are retrieving them with good vitrification techniques, the retrieval rate is around 85 to 90%. However, the chances of fertilization is around 70 to 75%, and the chance of having a baby is equal to the chance a normal woman would have at that point of age. So the age you're undergoing fertility preservation is very important. For example, if a woman undergoes fertility preservation or freezing of eggs at 35 years of age, she will have the success rates of IVF or pregnancy equal to a woman who is 35 years of age. So even with her eggs which she has preserved at this age, she will have a lower success rate than a woman who has frozen her eggs below 30, or you can say mid-20s. So the number of eggs is not equal to your pregnancy chances. So that is very important to understand. So many a times when we counsel patients for fertility preservation, we just don't say that go for fertility preservation, you preserve your future fertility. Then that is overhyping fertility preservation. So you have to have a very realistic expectation, the number of eggs which is retrieved, what was the quality of the eggs. These are the factors which your future success rates will depend. And fertility preservation also depends upon the vitrification technique. So the person who is freezing, a very good vitrification technique will lead to a better chance of egg survival and a better embryo formation later on. And it will also depend upon the experience of the doctor under whom you are undergoing the fertility preservation, who will be guiding you step by step at that point of time. So fertility preservation, the expense again varies from person to person. For sperm cryopreservation, it is quite nominal. They just have to pay the yearly storage charges. So it may vary from 10 to 15,000 from center to center. For egg or embryo cryopreservation, the cycle cost is nearly equal to IVF cycle in addition to yearly storage charges. So depending upon how long you want to store, maybe per year you have to pay a storage charge. So yes, it is a bit expensive, but again, if you think about the purpose, then maybe that expense will not seem too much. So at PHs, the egg cryopreservation rates or the embryo cryopreservation rates are nearly equal to an IVF cycle. So we have divided into your injection costs, which will be required to make the matured eggs, and freezing costs, the lab procedures. So that is amounts up to 1.2 lakhs, and then the yearly storage charges, which is around 15,000 per year. For sperm cryopreservation, it is much less. It amounts up to 10,000 per year. This is Dr. Prajnanika, focused on your fertility health. For more such content, please like and subscribe to the channel.